I am thrilled to welcome you all to our final featured presentation of the 2021 Smart Start Conference. We're focusing today on supporting early care and education professionals, which is the final featured session. I'm Amy Cubbage, president of the North Carolina Partnership for Children, and we are really glad to have all of you back with us to dive deeply into an issue that is near and dear to many of us who are here today. And during our featured sessions, we've done that over the past 3 weeks, discussed needs and strategies facing early childhood in the early childhood field in rural communities, and then also had a wonderful last week bipartisan discussion about early childhood policy and the policy landscape in North Carolina. And today we are really focusing in on the challenges facing the early childhood workforce and some promising solutions. This is very close to my heart. I started my career on the West Coast in teaching in early care and education at 2 different child care centers, and had the wonderful opportunity to work with some of the leaders of the Worthy Wages movement in the 90s. And there was another place where things were getting very, the field was really speaking up. People were elevating the issues around the workforce, and that was the state of North Carolina. There were happening many other places. I should not leave out Wisconsin and places in the South and the Northeast, et cetera. But it's exciting to be here in North Carolina, which is one of the birthplaces of the Great Worthy Wages movement. The critical importance of finding new solutions for the workforce and for the challenges is a thread that's woven throughout the featured sessions, and it's something that many of us are confronted with every day. Across the country, too many of the professionals who care for and educate our youngest children receive wages that aren't nearly enough to actually make ends meet. Many work without access to health insurance or other benefits, and arguably are doing the most important and most impactful work in a society, bar none. The pandemic did not start this crisis, but it shone a bright light on the injustice of treating childcare teachers as essential workers while refusing to pay them a living wage or recognize them as professionals. Here in North Carolina, childcare teachers make an average of $12 an hour. Childcare teachers are 7 times more likely to live in poverty than public school teachers. And that is why we've joined with our friends at the North Carolina Early Education Coalition to elevate the importance, as they have been leading the Worthy Wages movement and celebrations this spring. And the Smart Start Network is also working with partners to expand the wages program. For our friends across the state and at CCSA in Durham. And the wages program provides education-based supplements to teachers across the state. And in North Carolina last year, nearly 4,000 teachers received those supplements. And we really hope that we can expand this and reach even more in the future. We know that early care and education professionals provide their expertise, time, and energy in supporting children. We know that comprehensive supports are needed to the workforce to increase compensation, improve benefits, and strengthen the pipeline in the recruiting. And we also know this is an issue of equity. It's valuing the work of women, and especially women of color. The renewed focus on the importance of childcare for our economic recovery has fueled new interest in addressing these pressing issues. And policy discussions at state and federal levels present opportunities to strengthen the early childhood workforce, support early childhood professionals, and build out a sustainable system. Today, I'd like to explore these issues with you and with our very esteemed panelists that we are so honored to have with us today. I'm also pleased to moderate this session and to learn with and from our panel of experts. So without further ado, I will turn it over to welcome our panelists and let them introduce themselves. We will start with Dr. Ashley Williams, who's Senior Policy Analyst at the Center for the Study of Childcare Employment. Ashley?
Thank you, Amy. Thank you, everyone, for inviting me to represent the Center for the Study of Childcare Employment. in our work and research that we've engaged in over the past 20 years. I've been with the center over a year, but come to this work as someone who's an early educator, preschool director myself, and went into teacher education to support preschool teachers to teach our babies. So I'm happy to draw on my experience and CSCCE's research and policy analysis to inform our discussion today. So thank you so much.
Thank you so much. It's wonderful to have you and to have that breadth of experience across having come from teaching into directing and administration and now into the higher ed and research world. And we also have two folks from our wonderful Smart Start local partnership in Watauga County, the Children's Council of Watauga. And I will allow Elisha Childers to introduce herself first, and then Hunter Varipapa after. Elisha?
Good morning. I'm Elisha Childers. I'm the Executive Director of the Children's Council of Watauga County. And as Amy said, we are the Smart Start Partnership for Watauga County. And we're here today to share with you information about our Pathways to Accreditation program and also how we blend both public and private dollars to increase and support the wages of our local early childhood workforce.
I'm Hunter Varipapa. I work for the Children's Council of Watauga County. I'm the Early Care and Education Director here. And 20 years ago, I started as a director of a nonprofit child development center and saw the struggles that we see now, still 20 years later, and also was a pre-K teacher. And then when I decided to have my own children, I knew about the struggles in early care and education. So I wanted to take a step back, but came on board here at the Children's Council and actually got to help the system building in our county, which was just an amazing experience, and it continues to be so important, and I'm excited to be here and talk about it.
Thank you very much, Hunter and Elisha. It's great to have you here. We also have Sheha Waters joining us, and Sheha, you are the owner of the Little Warriors Child Care Center, and welcome.
Thank you. Thank you for having me. My name is Sheha Waters. I'm from Goldsboro, North Carolina, and I'm the owner and director of Little Warriors Child Care. And we've recently opened our second location, Little Warriors Christian Academy, which is specifically tailored toward the virtual learners in our NC Pre-K program. I've been in the field for almost 8 years. We've served over 200 children in Wayne County, and I'm very passionate about early childhood, and I am excited to be here, and thank you for having me.
Thank you very much, and thank you for being an example of someone who has survived it, thrived in it, or you're continuing, but also speaking out and recognizing and not shying away from addressing the challenges. I look forward to hearing more from you. We also have another local partnership represented on our panel, which I'm thrilled about, from Stokes County. We have Cindy Tuttle, who's executive director there, and Dianne Durham, and I will let them introduce themselves. Cindy?
Good morning, everybody. Thank you so much for inviting us to participate in this panel discussion. I am Cindy Tuttle, executive director of Stokes Partnership for Children, the local Smart Start organization. I've been here for about 19 years and have a background in social work, primarily in the arts, odd as that may seem, but using that creativity, I think we've designed some programs that might be of interest to some other folks in our state and beyond. And today I'm going to talk about the workforce innovation to support early education. We affectionately call that WISE, and I'll a little bit get into more detail about the need, but primarily it is to increase the workforce of college level early childhood professionals through college credits.
Good morning, I'm Dianne Durham, and I am so thrilled to be here because I've been in the early childhood area since 1980. And so I have always had a passion for and have always said I wanted to live long enough to see a society who valued their children. and had an experience with a family member one time who was so upset because his child's daycare fees had been raised by $1 a week. But in the same conversation was thrilled to death he had found the mechanic to fix his truck at $60 an hour. And I talked with him to great extent about what that says about what he values in his life, and have been preaching that since 1980, or trying to. But unfortunately, it still exists today that early childhood professionals are not seen pretty much as professionals, not by everyone. There are several people now, and I think it's much better than it used to be, but it still is a profession that is looked at as anybody can do it, because all you do is just interact with children, and you don't really need a big education, but research tells us much different facts than that. But like I said, I've been here for a long time, and I will be glad to talk and happy to talk about what Cindy has developed and come up with a program to help educate our early childhood providers. So thank you so much for allowing me to be here today.
Thank you so much, Cindy and Dianne. Really appreciate that. And Dianne, you raised such an important point that there was advocacy going on for early care and education for years. As we know, it is so tied to the work that women have been doing throughout history, women of color, of caring and educating. And again, as I said earlier, the most impactful work, and yet you hold it up against other jobs. And you're seeing the disparity of what you're just describing. That might have been at a time when what I'd say it was a $5 to $6 an hour salary, and there's someone complaining and saying, but I'm so happy that I found a mechanic to do $60. Not to, again, value one over the other, but just to say the disparity is so great, and that advocacy is important, and we're grateful for the foundation that pioneers in the movement for worthy wages and compensation and rights raises and respect set. So without further ado, I would like to jump into some of the questions we have, and please, those of you who are participating as audience members, feel free to use the chat box or Q&A box in your Zoom to put questions in, and I will be alerted to them and try to intersperse them. But if not, if we don't have time during it, we have about 10-15 minutes set aside at the end to do that. I'm hopeful. We have a lot to cover here, but please do put them in, and then even if we have to respond after the fact, we'll do that. So first, I would like to bring the question to you, Ashley. The Center for the Study of Childcare Employment at UC Berkeley each year publishes a wonderful report, a powerful report. A lot of us look for it and read it and are excited for it each year, as depressing as it often is, the Early Childhood Workforce Index. And could you give us an overview of the relevant information from this most recent version, please?
Absolutely. So yes, the Workforce Index, and I'll drop.
Ashley, you muted, I think, and thank you. You were putting it in the box. Yeah.
That's important. I should be off mute. Thank you so much, Amy. Yes, so the Workforce Index is a report that we put out every 2 years that provides a state-by-state look at policies and conditions affecting the workforce. So since 2016, the index has provided, a national and a state level look at policies in essential areas that include workforce qualifications, work environments, compensation, and we use that to highlight the experiences and working conditions of the workforce. And really, we use it to highlight issues of inequity and injustice that the ECE workforce faces. And the index has made it clear that the ECE system, as it is, does a disservice to our educators, largely women and mostly women of color. Ultimately, we have a system in which ECE is organized, and we need a system where ECE is organized and resourced as a public good. And so we're relying on parent fees and limited public provision and disparate funding sources and requirements that kind of leave us with the system that isn't serving our children, our families, and our educators well. So I'll spend a little bit of time giving an overview about how deep these inequities are for the workforce and underscore the essence of this conversation, which is we need radical reform. We need to build a system anew in order to address inequities that are baked into the system. So in every report edition since 2016, we've ranked every occupation in the US by average pay. And now in our 2020 index, it remains the case that only 2% of all of the occupations in the United States of America earn less than childcare workers, who earn $11.65 an hour on average. For preschool teachers, it's not much higher. And so working in ECE ends up being a route to poverty for many. Poverty rates on average are nearly 8 times higher for early educators than poverty rates for K-8 teachers. Amy highlight some of these points from North Carolina, but I want to emphasize and go a little deeper. In North Carolina, there's a workforce of about 37,000 members working with almost 735,000 children ages 0 to 5. And the median wage in the state for childcare workers, so these are folks that are working with usually infant toddlers before 4 years old and higher, they earn about $10.62 an hour. It's a 3% increase since 2017. And it's about $12.83 for preschool teachers. And that's it's actually a 1% decrease since 2017. For preschools and childcare center directors, the median wage is $20.88, and that's a 5% decrease since 2017. And so also our index highlighted that no state set required compensation standards for the workforce in ECE settings outside of pre-K. And so that's including infant toddler teachers. So this is a critical point to highlight, especially as we're seeing more strategies that actually deepen the divide between childcare and education in ECE and the national and state level proposals that we're seeing. So young children, regardless of age setting, they need well-prepared and supported teachers. Yet we know in our current system, it's the case, the younger the child, the lesser the pay. This is the most sensitive period of brain development in the first 3 years of life, and teaching the youngest children stands to be some of the most lasting work that has the most lasting value. But the current pay structure renders jobs working with infants and toddlers the least financially attractive. I don't have the specific data for North Carolina, but we can look at California as an example. In California, infant toddler educators earned in 2021 dollars, it's about $16.59, while educators working solely with 3 to 5 year olds earned about $19.75 in today's dollars. So for an early educator working full-time, this is a result of difference of about $6,500. That's a significant pay penalty just because they're working with younger children. And so we find that this pay penalty persists at every educational level. And even teachers with a bachelor or graduate degrees make less when they're working with infants and toddlers than those who are working with older children. I would also like to share kind of across states, policies to support and increase compensation for the workforce is the area where we see the most evidence of stalled policies. So we aren't seeing progression in this critical area. Additionally, compensation is a critical component of support for the workforce, but a respected and valued workforce also requires supports that ensure their physical, emotional, and overall health and well-being. And the health and well-being of the workforce is the second area in the index where we see the least amount of movement. And so this is true for North Carolina as well when it comes to ensuring income supports for the workforce, such as earned income or refundable childcare tax credits, or ensuring that they at least earn higher than the federal minimum wage, as well as laws that ensure that they have paid sick days, family leave, expanded Medicaid eligibility. So these are areas where we're not seeing a lot of progression. And so when I kind of situate that, the reality is, so we aren't compensating folks well, and we aren't attending to their health and well-being. And this was prior to the pandemic, which just exacerbated these longstanding issues for the workforce. Yet policy proposals, as Amy was saying earlier, to directly address compensation and health and well-being for the workforce are scant. And so I have a hard time and just kind of raise the question, and this is what I'm constantly grappling with, is how can we even try to reimagine a better system for children and families if we aren't addressing these critical issues for the workforce? So I'll leave it here, and I'll also drop in the link directly to the North Carolina Workforce Index profile.
Thank you so much, Ashley. And thank you to you and your colleagues for never dropping this, for keeping going. Your wonderful founder, Marcy Whitebook, and others have just been, again, the pioneers, and we're so grateful. And you raise the incredibly troubling trends, two of them, of that we're going lower in pay since 2017 on some key factors that you mentioned, as well as the decrease in age means a decrease in pay. And we know the bang for your buck in 0 to 3 is like nothing else that we can do for betterment of society as a whole. So that is astounding. And I would love to turn now to our folks who are working in communities on this, and specifically first to Cindy and Dianne. Could you speak to how those findings sit with you, and what are the challenges that you're seeing at the local level in Stokes County to start with? And then I'd love to hear Elisha and Hunter about Watauga, and then also your experience in Wayne County, Sheha, as a provider. So to start, Cindy or Dianne?
Okay, yeah, I can 100% agree with what Dr. Williams just said. In Stokes, our lowest educated workforce works in the infant toddler classrooms, and we have tried to put a special emphasis in identifying as a top area of need that those working in those classrooms increase their college level in the education field. But in general, Stokes is greatly impacted by the lack of a workforce overall. We have such a limited number of teachers that some of our centers cannot open their vacant classrooms, and childcare is very limited in our county. In the northern part of our county, we have absolutely no childcare, and we're really worried about illegal childcare that is happening. And I mean, it's the same as what Dr. Williams said. There's a little draw into and appeal to the early childhood workforce at this time. Many of our current teachers do not have any type of benefits. Their pay is very low. Our NC pre-K classrooms struggle to find and afford qualified teachers. And oftentimes a teacher starts out in a private center or Head Start classroom while working toward a BK teaching licensure. But once that licensure is obtained, they leave those centers and go into the public schools where they have a higher salary and better benefits. And we've also found a disturbing trend in the past where our high school students have been deliberately and purposely redirected around early childhood education as a potential career due to the stigma of hard work and low pay. So yes, Stokes is greatly impacted by all that was found in Dr. Williams' report.
So challenging to recruit and build a pipeline. And then even, I shuddered to think that would be guidance counselor advice, college advice, career advice to high schoolers. And yet those of us who know the field think, well, what are we telling our own children? What are we thinking? What is the message? Thank you. Dianne, anything to add to that? That was a wonderful.
No, I think Cindy covered that one very well. So.
Okay, I'll turn it over then. Thank you very much. Alicia and Hunter?
I'd almost say ditto to what, Cindy said. What they're experiencing in Stokes is, I think, what we're experiencing in Watauga, and I would imagine in other communities across North Carolina as well. Just infant toddler care is scarce, nearly non-existent here. It's very difficult to come by when it does exist. And, when we have a lot of vacant rooms, it's hard to rehire that staff back in right now. The pool of available teachers is not deep. The pool of substitutes to go into classrooms when teachers are sick or need to be out is not deep. And so those are all challenges that we certainly deal with in Watauga. Of course, we have the primarily female workforce as well here, just like we see across our nation. And as Dr. Williams mentioned, Hunter, what would you add to that?
So it kind of brings out the story where my first class at Appalachian State University in child development that I sat down and they said, if you're here for the money, you need to walk out. And I stayed because I was in it for my heart. And then I started a nonprofit child development center, and I was a director, and they were going to pay me $24,000 a year. And I knew that I needed to hire staff. So I gave up, I went down to 20 to be able to hire some staff for that program. And then once we hired them and trained them, 3 months later, they would find a higher paying job in the school system or in Charlotte or at a corporation. And so it's been a struggle forever. And then in my current job, when I went out to do one of my first class observations, the teacher that I was observing had had a baby 8 days earlier, and she could not afford to have her child at that child care center. So her 14-year-old was watching that child in her home, and you could tell by her emotional and physical health was just not there, and there was children crying and she couldn't help them. She was not present because she was living in her own stress. And so it is a real thing, and we all know it. And so hopefully, by creating these programs, these grassroots and at a national level, and I think right now it's highlighted the need of it because of the pandemic. And so I think we need to keep the momentum going with it. So yes, we see it in teacher turnover, all of it, everything that everybody said.
And Sheha, thank you very much, Hunter and Elisha. That story is so poignant and powerful, Hunter. And someone who's 8 days just had a baby and is into caring for other folks' children, and we know earning poverty wages. Sheha, do you have some insights there you'd like to share?
Yes, I could say representing Wayne County, Goldsboro, North Carolina, the providers here are struggling. Prior to the pandemic, we were really struggling, but the majority of us have lost 50% of our enrollment, and we are still trying to maintain and pay quality childcare teachers and provide quality care, which has gotten extremely expensive in addition to the purchasing of chemicals, masks, making sure our staff are safe. We had a COVID scare, we had to close down. And when we came back, some of the parents were scared. So the majority of my provider colleagues are hiring. And I have had to actually close my baby room because I cannot find a quality certified teacher. And I'm constantly getting phone calls for babies. And I have a waiting list in a closed baby room, and I cannot find quality teachers. We have gotten support from our Partnership for Children, Valerie Ward, Shelley Bullis. They have been helping us. We've gotten, chemicals from the governor and things like that, but it's not enough. Quality childcare costs, and we need quality funds to provide that. So everything that everyone said is extremely true. In Wayne County, we are struggling. So I'm hoping that we can get some help and assistance.
Thank you, Sheha. And that leads really into that next question I was going to ask you, and to talk about how is the subsidy system helping you? What are the challenges there with it? As you said, you're appreciative of these supports and help, but I think what we're all talking about is the radical reform, Dr. Williams, that you, I think, used that phrase, is needed. But how are some of those supports helping you, Sheha? You mentioned the support you're getting from the local partnership, but especially on subsidy.
Yes, well, for starters, the partnership, they have donated chemicals. They have given additional resources to our teachers. They have helped buy masks for our kids, as well as clean our facilities. But the subsidy dollars we're thankful for. However, we haven't received an increasement in almost 3 years. And the price of living is going up. Quality childcare prices are going up and we are not receiving an increasement. I lose a lot of my staff to the school systems because I can only pay them at the maximum, maybe $12 to $14 an hour. And you have BK teachers with licensures, they can go to the school system and get more money than that. I have gone months without taking a check to make sure that my staff are covered. I have offered bonuses to them and, do additional things, treating them to lunch to try to make them feel appreciative. I have lost a lot of good teachers to the school system because I cannot afford to pay them. So I'm hoping that the subsidy dollars will increase so that we can continue to provide quality childcare. I run 2 4-star centers in this town and we need quality teachers. So the subsidy dollars are where the majority of my income comes from. I serve a lot of low-income children, and we need the increasement of subsidy to help provide quality care. So those are the struggles that we are having, as well as not finding quality teachers and being able to pay them.
Thank you very much for framing it in that way. And it really speaks. I remember my final newsletter column to the child care center and the families and teachers and staff when I left my last formal teaching job in Seattle was about, I'm leaving, I'm going off to take on lots of loans in law school, work part-time, but I cannot continue on with that. That time it was $8 an hour, and it just was, and people leaving for many other very reasons across the board, but it's just a struggle to stay in the field and for you to recruit and retain. Ashley, could you speak to as well the issue of racial equity in this workforce, something that we're hearing more about? Finally, we're saying we are not going to be publishing reports unless we can get the disaggregated data, or at least we're going to talk about this is missing in this report, which I think highlights then the need to put resources toward ensuring that we find out what the differences are when we're really talking about reaching. For us in Smart Start, we talk about each child in every community, but are we really reaching each child? And then likewise, are we reaching every teacher with compensation and recruitment and retention strategies, or what are the differences? Thank you.
Yes, thank you for that, Amy. And I think that is an important piece of the picture. And I want to dial it back a little bit because as we try to address the needs of the workforce, we have to center equity. But there's a way in which we have to do it, I've noticed. So we have to center equity, not as a word. We hear it so much. We hear equity and, all of the time. And in my analysis and in our work, of policy proposals at the state or national level that are in the name of a more equitable ECE system, a lot of these proposals actually put forth recommendations and solutions that drive inequities for the workforce. And so, and that's happening because sometimes we're so tied to mechanisms and structures in the systems that don't address the needs for the workforce or see the workforce as an afterthought. They aren't designed to directly impact compensation, working conditions for the workforce. So if these strategies or mechanisms aren't tied to that, they're actually kind of driving these inequities that we're seeing. And so when I say center equity, I mean equity as a verb, and our ways of being, like it has to kind of match, the actions have to kind of match the proposal. So if we're saying we want an equitable system, we have to be addressing the inequities for the workforce, right? And so I think to get there, it's really important that we address the historical context of our system. We have to understand and really grapple with, how did we get the current system that we have right now that is rife with inequities, causing the most harm for women of color? How did we even get here? And so first, we have to acknowledge that we have a deep-rooted history in the United States of devaluing labor performed by people of color, immigrants, and women. And this history has converged to render early educators as one of the most underpaid and under-resourced occupations across our communities. And this also has a deep-rooted history in the enslavement of Black women forced to care for white children with more priority over their own, right? So we have to kind of acknowledge this historical context and then bring in the fact that ECE is not immune to racism and biases that pervade our systems and our society. And within this, there are stark disparities that exist for women of color who are experiencing some of the greatest harm stemming from the way in which the current system is organized, funded, and directed. And last, we have to kind of work, and this is what I'm saying about equity as a verb, we have to work to kind of resolve those root causes that undermine the dignity, well-being, and effectiveness of the current and future ECE workforce, while also working to kind of heal the historical and contemporary harm that has happened. So with that understanding, kind of to get to your question, it's critical that we center equity to address systemic structures, mindsets, ideas about the women who perform this work. And so we have to understand and prioritize those who are most marginalized in the system. And so right now, the reality is there are racial wage gaps in ECE that reveal particular harm for Black women. Black early educators, they're paid on average 78 cents less per hour than their white peers. And that is when you control for educational levels, roles. So that's not North Carolina specific, but in our national data. Further, Black early educators are more likely than their peers to work with infants and toddlers. And so I was kind of giving that bit at the beginning when I started. So this actually compounds the wage gaps for Black early educators. So it's clear that we're not dealing with issues of, we're not only just dealing with issues of economic dignity for the workforce broadly for everyone, but we also need to address the racial injustices that are present within these racial wage gaps in ECE. And we also can't lose sight of the fact that Black and Latino folks are the ones who, are experiencing low incomes. And in other words, they belong to communities in which nearly, all of our educators are connected in some ways, but they're disproportionately hospitalized and dying from COVID, right? So we have to kind of take into account these things. So I would say, to simply answer that question, yes, we have to incorporate existing data that kind of helps us understand how the impact is landing for our workforce. And we have to establish new equity metrics that help us understand the disproportionate impacts of our policies and the ways in which they may actually be driving inequities instead of addressing them.
Thank you so much, Ashley. That is so important. I said the other day when you said, slow down to start, or you said, let's take a step back here. The other day I was speaking on something, it was about the not moving the needle, excuse me, think babies, too many in my brain right now, but so much of what you're saying resonates. But as we think about think babies, I say we have to go super fast on change to policies, and we have to also go very slow and thoughtfully when we're talking about racial equity and who's at the table and whose voices are being heard. And again, I think about the data and, let's be articulate about what is missing here if we're missing data, et cetera. So thank you for doing that. I think given time, I want to turn now to hear some of the specific strategies and comprehensive approaches that are taking place. As much as we would like it to be radical reform across the country, across the state, it is happening in some places. And as even with doing the best you can with the resources you have, I'd like to focus on Cindy and Dianne from Stokes and talking about giving an overview of the WISE program, if you would, and why you started the program and a summary of the work you're doing there.
Okay, great. We're always really excited to talk about our workforce program, and its full name is Workforce Innovation to Support Early Education, but its nickname is WISE. So I'm going to call it WISE, and you'll know what I am referring to. But the bottom line with the WISE program is the ultimate goal is to increase the number of students interested in pursuing a degree in early childhood education, resulting in an increase in the workforce of higher educated early childhood professional through college credits. And we give priority to high school and early college students who are enrolled in at least one 3-semester credit hour early childhood college level course. And WISE is also open to the early childhood teachers already in the field. And to give a little background and how this came to be, the basic concepts of WISE were developed back in 2015. And this was a collaboration formed between Stokes Partnership for Children, Forsyth Tech, and the North Carolina Community College System. And the community colleges at the time, and some of you who've been around a while may remember some of this, the community colleges were looking at ways to address the needs outlined in the Early Childhood Education Innovation Fund, which evolved out of the Race to the Top Early Learning Challenge federal grant that was awarded to the state of North Carolina. And this grant was designed to provide opportunities for North Carolina community colleges to increase access to and improve the quality of their early childhood education programs. And during this time, the enrollment in the community college classes had dropped significantly, especially in early childhood. And the community college lacked articulation agreements between the community colleges and the local high schools. And also too, across the state, as it is now, teacher education levels were also at an all-time low. And so if you fast forward to today, in our current reality really amplifies the need for such programs as WISE. And we meet several needs, but one that probably everyone that's tuned in is going to be familiar with is Leandro versus the state of North Carolina. This program directly impacts the action steps outlined in the action plan. And WISE addresses the action steps outlined to increase the volume and quality of the early childhood educator pipeline. And in Stokes, we continue to struggle with our education levels for early childhood teachers, especially in the private childcare sites, as we've discussed earlier. And what's even more concerning for us is that the lowest educated teachers are in the infant toddler classrooms. And also, it was interesting to note that in our recent needs assessment, a top concern that the community defined was that early childhood and pre-K teachers are not recognized adequately as professionals, and that the community feels that these teachers need college educations. And that was defined and written in multiple times in the written in section of our needs assessment. So it was interesting that the community is recognizing that as well. But from way back in 2015, the basic goals and objectives of WISE were defined, and they remain to be true today. I'm going to let Dianne go into the real nuts and bolts of this, but the bottom line is the WISE program is designed to increase the number of students interested in pursuing an early childhood education degree, which may result in an increase in the workforce of higher educated professionals. We want to decrease barriers and create a more seamless pathway to college credits for high school students through articulation and collaboration. We also want to provide, and this is very important, we also want to provide an opportunity for paid work-based learning. We also engage local early childhood education partners in discussions about increasing the use of college credits across systems and strategies. And we provide enhanced professional development opportunities. So I'm going to let Dianne just break it down for you. Dianne is our WISE program coordinator, does a beautiful job. You can tell she's very passionate about what she does. So Dianne, if you'll just, you'll break it down into how all this works for us.
Okay, as Cindy said, we do offer this program to Stokes County High School and early college students, as well as the early childhood profession workforce here in Stokes County. To be eligible to participate, they must be enrolled in at least a 3-hour early childhood class that leads to a diploma, certificate, or degree. They have to either live or work in Stokes County. And they have to show that they are, well, they're currently enrolled and that they are taking are committed to taking the early childhood education. As an incentive, we provide financial support, which averages to about $20 to $30 an hour during a 16-week WISE session. And I also work very closely with the students to provide educational opportunities, professional development, and support. As I meet individually with WISE participants, I try to find out what their interest area is. Statistically, behavior challenges has been number one by far, that people are interested in increasing their skills and knowledge in those areas. But I've also had people who wanted a lot more infant toddler development, developmentally appropriate activities. So I work and try to find activities that meet their needs as to what they want to gain skills and knowledge in. This is accomplished through a 16-week session where they have the participants complete a 50-hour participation or activities. In the past, part of that was required to be observations in early childhood programs. However, the pandemic put a stop to that. So we have done a lot of virtual activities, as well as I have continued to meet individually with all of the COVID protocols in place to ensure that they do have adequate opportunities to meet those 50-hour requirements. Anybody that is enrolled in the early childhood course getting their associate's degree, their practicum, the last 4-hour class that they have to take in order to complete that, all of the hours required for the practicum count toward the 50 hours that is required for WISE. So anybody taking a practicum, it's a wonderful opportunity for them to receive some financial assistance while they're doing that. We also can help with tuition if that's needed for individuals. To obtain hours, my schedule is very, very flexible. So I can adjust my work schedule to meet the needs of the participants if they have an additional job outside of early childhood. If they have family obligations, I can arrange my schedule to meet morning, night, weekends, whenever is most convenient for them, because we want to do this to enhance their skills and knowledge and not have them feel like it's a commitment to meeting what Stokes Partnership wants them to do. We want this to be very positive for them. We try to get them, to focus on we have a lot of opportunities for them to learn, because we offer resilience and adverse childhood experience training, experiences relating to STEM and increasing those activities in the classroom, diversity, child development, outdoor learning. Professionalism is something that a lot of us have worked on, and I provide a training in professionalism that counts. We do pyramid models, conscious discipline, work on social emotional health, and any other activities that I deem as relevant. It could be something that they're very interested in and they have found something on their own that we don't have listed, but they can talk to me, and what they're required to do is to request to participate in an activity. Then they write up a brief summary of that activity, and then the participant and I sit down and discuss what they gained from it, any questions they may have about it. We take the starfish approach with WISE, in that one student at a time. We feel like if we can make one teacher in a classroom, then that's going to have a lasting effect of all of the individual children that she teaches in the future. And I try to act as their mentor. I have been in early childhood, and I try to remind myself that it has taken me 40 some years to get the information inside my head that I have now. So I try to be very, very patient with the participants and help them understand what the process is going to be like, learning stuff all along the way. Let's see, we take field trips if at all possible. We have been to the Child Care Commission so that individuals get a good understanding of how the whole profession works, how the laws are made, why the laws are changed sometimes. And as far as we've been to the North Carolina Partnership to show them our supporting partners. So we really try to make it a really diverse experience for the individuals. We let them attend our board meetings and participate in other partnership events. So they get an idea of spreading the word in the community, meeting your community, and understanding the needs of the community. So it's a wonderful, wonderful program, I think, and it really does provide an enhanced quality experience for individuals. And we have had some very good success stories that people have written us at the end of that. Just briefly for compensation, if a participant successfully completes all 50 required activities, they receive $750 total. There is a $500 educational component that if they are not reimbursed by Teach or other financial Pell Grants or whatever, if they have to pay tuition out of pocket, then we can help reimburse them with the tuition. And then there's $250 if they have to do travel, if they attend meetings and have to pay conference registrations and stuff, then we can compensate, reimburse them for up to $250, making it possible to earn $1,500 totally. So most people, I would say, average around $1,000 when they participate. So,
as well as getting compensated for their time during the participation. Is that correct?
Well, the compensation for their time, that's included in the $750.
The $750, gotcha.
That
Okay.
covers if they complete all of the requirements, then the $750 covers that time that they have spent, yes, completing the activities.
Thank you, Diane. That was very helpful. Cindy, were you going to add one?
Yeah, I was just going to add really quick. I know we're running out of time, but I did want to state that the program is expanding. There was a great breakthrough in our high schools recently, and a new collaboration was formed between Forsyth Tech Community College and the Stokes County Schools to form an educational partnership to provide career and college promise and career and technical education coursework in the public schools, including the early childhood education courses. And in a separate Smart Start activity, we fund an itinerant instructor position with Forsyth Tech. So she's actually going into the high schools and teaching these early childhood courses. And also, due to this expansion, high school students who take an internship as part of their graduation requirements, they can get paid work-based learning through the WISE program. So it's a big incentive. Maybe they won't have to go to work at McDonald's for that 16-week period, so they can actually get paid for their work-based learning. And also this year we were awarded a Ribbon of Hope grant from the North Carolina GlaxoSmithKline Foundation to support the anticipated increase in WISE participation of high school and early college students for next school year. So we're real excited about that. So
yeah, thank you very much, Cindy. Thank you, Diane. I love what you said about meeting teachers where they're at and recognizing the challenges they're facing in their lives and the commitment they've made to the field, and just starting at that place, and the, of course, parallel process, and the way that mirrors how we hope always to relate to children in meeting them where they're at. And it's one of the things that gives you the most hope and joy for our early childhood profession transforming society in the world, because we do that and we hold that true. So thank you. Lots of great stuff you're doing there. I'd also like to give a chance now to turn to Elisha and Hunter and hear about the specific program you're doing with the accreditation program in Watauga County.
Right. So we started our accreditation program it started about 4 years ago. And it was created because when we would get TA calls, basically they would want us to come out. They were getting the Eckers or Itters or Fickers like in a month, and they wanted us to come out and tell them what they should have in their classroom environment to get to that level. And so I did that a couple times, and I just started TA, and I was like, this is kind of like cheating the system, because they could do this. They can put the blocks in their area. They can have this, but then for 3 years, they're not assessed again. And we want them to live by it. Like I lived by the Eckers when I was a pre-K teacher, and there's so many different parts of that, and it's so amazing. And we looked at NACCE's accreditation, and it is amazing. It would be a hard reach for a lot of our local programs to get to that level. And so we thought, what if we created a local accreditation program that could get them to be able to get to that NACCE accreditation, and that would look at all these areas. And so one thing that I saw missing was the relationships between the teachers and the children together, and the relationships with the directors and teachers, all of this. And so basically I started looking at the class, and we went in and started doing class evaluations and saw that the scores were really low. And so we wanted to build a program that supported the whole program. And so we created the Pathways to Accreditation program, and it's voluntary. And we have programs, family child care homes, as well as our early care and education programs have joined up. All of our NC pre-K teachers as sites have joined, and our Head Start. And so what we've done is created 8 standards, and the first one is the early childhood education standard, which looks at the teachers gaining their associate's degree if they do not have one. And that is a requirement of the program, that they agree to be in an associate's degree or have obtained it at least. And then we work with them on professional development plans and how to get them enrolled in the community college, and we work closely with them as well. And then the compensation, we were looking at, $8 to $9 when they began. And so we made it a requirement that they would get $12 at least an hour. And so that is a requirement of that standard. And then we have a physical environment standard, which encompasses the star rated, so the Itters, Eckers, and Fickers, as well as the DCDE reports and with that. And so we can help with that as well. And we have the health and safety requirement, which again is the DCDEE. So we work with programs if they have violations or if they have administrative actions, and we create trainings and different professional development around those as well to help them through that. The relationship standards is basically we go out and do class on all new lead teachers within the first 3 months to get a baseline to see where they are and what they need. And then we create a PLC. We've created PLCs with our infant toddler teachers and with our preschool age teachers. And we design professional development series based on their needs. And so we've done a lot of conscious discipline, the pyramid model, just starting at the bottom too. You've got to get those in place before you can reach to curriculum and assessment. So we've done that. And through this, we wanted to create an early care and education system. So in our county, we saw, you have different private childcare settings and you have NC pre-K programs, and they're all pretty much isolated. They don't get to speak with other teachers. They don't get to be a professional. And, the trainings that they had to attend that were mandatory, they would have to come at night or they would have to come on the weekends and they wouldn't get paid. And so we decided that we would start to do our PLCs during the day, 2 different sessions, because it's hard to get a sub during the day anyway. And so we started that, and then we started a sub reimbursement program so they could attend our professional development learning communities and they would not lose pay, and they wouldn't have to come at night when you're tired from caring for children and the stress that you have in your life and on a Saturday, because as professionals, that's what we do. We do our work during the day. And so that has been really helpful. They come very present. You know, before COVID, we would have coffee, we would have snacks, and it just became this community of professionals where it was lacking before. And they really got to see other teachers. They have the same challenges or they have different strategies, and it just built this super amazing community. And I'm so glad that we did it before COVID, because then we went virtual and they were there and they were like, we're so glad that you're still here for us. And so that's been amazing. And they've all got to learn from each other. And the staff development portion. So we do have requirements, and you can look on our website for those. And it goes into how we implement it and how we measure the program for each different standard. And so we do a family partnership standard as well. And so we do a family engagement survey out to all the programs, and then we look and see which areas that they need growth in, and we help those programs develop family partnerships that are stronger. You know, as an NC pre-K teacher and a director, the families were like one of my favorite parts. And, you know, teachers, they need to have that, and directors need to have that as well, because that is a huge part of the child. And so we've really helped them build those bonds and support them in that. And then the curriculum assessment. So, you know, starting out, you know, I would say, what's your curriculum? And they would say the creative curriculum. I'm like, oh, tell me how you implement it. And they would be like, well, we have a book on the shelf over here. And I'm like, okay. So they had a curriculum on paper, but they really weren't using it and utilizing it and didn't have time to do it. And so we are helping them this year. We've purchased Teaching Strategies Gold for all of our programs, and we're doing our professional development around that, because that is one of our standards, but we have to support them in that as well. And so they're going to be doing that this year, and then learning about assessment. And we're getting child portfolios for all of them as well. And we have support through our program to help teachers get into the curriculum and to get to know it, and then to implement it as well. And then the last standard is behavioral support. And so, like we all know, there are challenges in early childhood education. Teachers don't come equipped for it. I was lucky. I got a degree first in psychology and special ed, and then went back for my birth through kindergarten licensure. So I had that background, but you come out with little knowledge about how to help challenging behaviors, and children, you know, of color and of up here, there's just a lot of challenges in early childhood education because teachers don't come prepared for it. And so children were getting expelled or suspended or asked to be taken home because they were biting. And now we have a behavioral support standard, which means the first contact you make is to us. If you feel like you're going to have to send a child home, or if you're having a challenging behavior, we come out and do an observation. We meet with the teacher and the director on strategies on how to support those children. And then we have a step-by-step, you can look at again, our standard on that of how to support the program and the teacher. And it's basically a whole classroom that we support, not just that child, but we work with the EC service providers as well too. And so that's been very helpful. And then we work with, and we get them to work with their families as well on this. And so children aren't being sent home, and most of it's like developmentally appropriate or teacher practice. And so we're really trying to add supports in there to help that as well. So that's like our program in a nutshell, but you can go on our website and look at our whole brochure pamphlet on it. And then Alicia's going to kind of describe how we raised the salaries and how we do the financial piece of it as well.
Yes, that was a lot, Hunter. It's a big program though, and it's one that we've been invested in launching. And so we're very fortunate to be able to, as Hunter said, the average wage of a lead teacher in our community, in our county, was $9.50 an hour. So getting to $12 for us was a big jump. And so we're using a blend of funding. Our county government is bought into this workforce investment locally, and they do provide an annual grant in which we use a portion of that to help with these wages. But we also use, in the world of Smart Start in North Carolina, we have dual subsidy funds, and that is how we use ours in Watauga County. it is a childcare subsidy to the center, and it is tied to that requirement that they pay their lead teacher that $12 an hour. And so that's something that they have to do. We're using blended money to make that happen with the childcare centers. And what we're hearing from our childcare centers, and this kind of goes back a little bit to that equity conversation we were having before, but when you pay the lead teacher a higher wage, it's not only that lead teacher that benefits, it changes the pay scale of the entire center. So everybody in the center is benefiting from that jump, and our subsidies help make that happen. So that's worked very well in this community.
Terrific. Thank you very much, Elisha, and thank you, Hunter. It is exciting to hear that these programs are in place. Likewise, Dianne and Cindy in Stokes, the WISE program is addressing both the recruitment, the pipeline, even starting with high school, and then carrying through for folks who have been in the field and have not been recognized for the deep expertise and knowledge, and to be given the credit for that, and to be treated as professionals as you are and see a career pathway is fantastic. I wanted to ask, are there any, I think you blended, both of you did, into your answers, both from Stokes and Watauga, but impacts that you see in the communities and maybe the biggest challenges in implementing those. And then we're going to, I think we're still not seeing any questions, so we have enough time to carry on. We'll get to the question I'd like to ask all of you about what would you like policymakers to know. And I'm especially, I'd love to, Sheha, I didn't cue you up for this, but I keep thinking about the what you're doing in, Dianne, you mentioned with field trips, if you will, to bring teacher voices, provider voices to the table. And then those of us who may already be, or may find ourselves often at the table in advocacy arenas, step back, be the drivers of the car, be the people, bring forward if you need to orchestrate or organize a field trip, provide substitutes, but don't be the voices. You are the voices and your teachers are the voices. So I want to jump back to that. But first, my question is to Elisha and Hunter and Cindy and Dianne about impacts on the communities and challenges, if there are any additional ones, because I think you did weave some in.
I would just reiterate what Hunter said. I've been with the agency coming up on 2 years, and one of the first things I did was go shadow her on one of those classes that and Hunter and one of our other TA staff were teaching on a topic that day. And it was so exciting and energizing. It was a fabulous training. But what I witnessed is exactly what she said, that community of early childhood professionals that were around the table. You could tell that they appreciated and benefited from being there together. And as Hunter said, it was just a different kind of training than I've seen and witnessed in the past, where people are having to take time on Saturdays or in the evenings to attend things. They were just so excited to be there in the middle of the day and get a good cup of coffee and some snacks and be, loved on by our TA staff and then participate in a training. And they were, by the end of the class, like, they had definitely had community. They're like, hey, I was having that in my class and this is what I did. They were exchanging ideas. It was definitely a system of support. And I would say, based on what the staff here is saying, that did not exist prior to this program. So, and we can talk about the impact of the wages all day long and the buy-in of this community and willingness to invest in that. And that's probably a challenge. It's like, okay, we got them to 12, we'd love to get them to 15, and we're talking about that in this community because our county just took their entire county workforce is up to 15 an hour. Appalachian State University also did the same thing. Nobody earns under $15 an hour. We have big employers here who are committed. to a minimum wage of $15 an hour. And we're saying, okay, we want the same thing for this workforce. So we're not leaving them out of the conversation. We're continuing. We see that as our job at our Smart Start partnership, that we've got to continually put this workforce front and center when we're talking about things about wages and workforce supports.
It's something that you've said before struck a chord for me, and I think with someone else in the audience, and is asking, could you review again, how did you get the subs and how do you pay the subs to and have the pool to allow for teachers to be able to do the trainings in the day during the daytime? Because that, I remember that as a teacher just being a constant struggle with saying, oh sure, yeah, we can fit this training in during my break time, my nap time, my time for my lunch. Seems incredibly unjust and unfair. So how are you doing that? Could you?
Right. So we do have like a sub program here, but it is very low number of people that actually we have to offer programs. So basically they use their own subs, and then we reimburse the center for that sub time. And so that's what we do. And then we do plan them around like naps and, you know, an afternoon session. So maybe they only utilize like one sub in the morning, or they can do that. And we have had really good participation. It's been wild because, you know, it is really hard to find a sub. And so one of our requirements is that they have to participate in 75% of our trainings, and we've never had an issue with that. And with directors, we have a Directors Leadership Academy as well once a month, and that has brought all the directors together, where when I was a director, I was like, who can help me? I don't know, you know, and just trying to reach out to other people. But directors are busy, you know, but to have that time set out for those directors and to gauge what they need. And, you know, directors are not scared to call us with a problem. They're not, you know, we hear about their things because they want us to help them. So it's really built that type of community with all of them. And, you know, up here in Boone, you think of it as like Appalachian State University's up here. There's a lot of second home owners, like the wealth up here. But then we have a really high poverty level, and people cannot afford to live here that work here. There's nobody that can afford to buy a house in Watauga County because of the second homeowners, especially during COVID. Like people are having to live in another county and then drive up for these low wages. And so we do see, you know, we still see issues, and we try to problem solve those as we go along.
Yes. Okay, thank you. And Cindy and Dianne, was there anything you wanted to highlight as stands out as a successful program or major challenge? Go ahead.
Yes. Some of the great successes that we've had is we have had 25 students participate in this, and 80% of them have been successful. We've seen a tremendous increase in the number of college hours and the professional development. But the thing for me personally that I see the most is when we have the participants do the resilience training, the pyramid model, conscious discipline, some of those that give insight into your personal beliefs, your personal prejudices, biases, or whatever, and that you truly can't change anyone except yourself. Because a lot of people come to the behavioral challenges issues wanting me to just give them a handout on how to fix a child. And I spend a great amount of time telling them that they can develop a relationship, but they can't, there is no magic quotient or whatever, potion to just put on that child and fix it. That it stems from a lot of things, and having them understand like traumatic childhood, brain development, and all of that. I have really seen individuals gain a tremendous insight into better understanding. and the importance of the relationships with the children and the families. And although, like we said, it can't come one person at a time, some of our major challenges remain in having the opportunity to provide that, for the participants. And Cindy's going to speak a little bit more on the challenges that we keep facing.
Okay, yes.
Well, the challenge is, as you can guess, is to find participants. Dianne mentioned that we've had 25 participants to date. What she didn't mention, though, was that once they participate, they come back for multiple sessions. If we can hook them and get them in the program, Dianne does an excellent job of keeping them in the program, and they continue with us as they continue to increase their education. But of course, the reason that we're having a hard time finding participants is what we've been talking about today, is the stigma of the early childhood education field, the low pay, hard work, limited benefits. And also, one of the things that we're really struggling with is communication. And we're seeing this now that we have the in with the high school and early colleges, is the communication. How do we reach a high school student when there's so much information being thrown at them from so many people about so many different careers? So one of the things that we're getting ready to launch is a marketing media campaign that will have videos and short videos, informational videos that'll speak to the students. Also a separate one that'll speak to the parents and the school professionals, school and community at large. And then we're also going to do a bunch of little mini videos that we're going to use on social media and TikTok and Facebook and everything you can think of. It's going to be fun. It's going to speak to those students and try to draw them in. But like I say, once we draw them in, usually we keep them. There's an 80% success rate. So, but yeah, finding and hooking them is the key.
Thank you. Excellent. I appreciate that, Cindy and Dianne. Dr. Williams, you need to leave soon, and I want to just give you a moment to any closing thoughts, final thoughts that you have to share. We're so appreciative that you could be here today.
Yes, no, I can hang on until about 8:30. I was just messaging Jessica. I think I made the mistake on my calendar, so I can hang on until about 8:30. So let's keep rolling with it. And
keep rolling. Okay, that's great. Thank you. Well, I did want to turn then to think about, you have the floor with the policymaker. You're in the public policy arena, and going back, Sheha, to my note that how do we bring people to the table, step back and hear the real voices of providers and teachers and the challenges and their deep expertise. I love how many of these programs center on the teacher, that is the key to quality, that is the key to our child outcomes, and for that we should hold them with deep respect. How do we get those messages across? Do you have thoughts on what the messages are or how to do it?
Well, I think if we start by just getting out here, I know the pandemic has caused social distancing, but getting in the centers, talking with the teachers and the providers and hearing them. We just want to be heard. We're fighting to take care of other kids better than our own sometimes. Increasing the funding will help the quality childcare cost and the quality teachers cost. The money is not aligned with the school systems. The school systems are priority over early childhood. It's been like that for a long time. But if we can get these legislators out and just see the environment, see what we're doing, we're making magic, we're growing brains. But some people need to come out and see what's going on to actually believe it, because we're not just sitting there watching kids all day. We are developing brains, and we're actually saving some of these kids' lives. Yes. A lot of the kids I've had one child that he got one day out and he overdosed and almost died because he took some medicine and his parent wasn't watching him. And I felt responsible because he had missed that day at school. So we're saving lives and we're growing brains, but we need backup and support, and we need people to come out and just see what we're doing.
Thank you very much. And that can be so powerful. It's not just bringing folks into the halls of the legislature, into arenas, but legislators, policymakers come in and see the actual work. Thank you. others. Dr. Williams, you have thoughts on that, on what are the key messages we need to say to policymakers?
I appreciated everything that you just offered, Sheha, and just yes, yes, and yes to all of that. And I think one of the critical messages is that, you know, the deficiency is in the system and not the people. It's not the workforce, it's not the people performing this work, but the system is broken and comes from a design that actually undermines and devalues our workforce. So I think that it absolutely is important and imperative for us to, one, engage our workforce and engage with them in ways that facilitate their shared understanding of the system. I can say that from my own experience as an early educator in a preschool program where I had no idea a whole system existed outside that was making decisions about how much money I was making, what quality was supposed to mean. I had no idea there was a whole system that was impacting me. All I know is I was a preschool teacher and I was working 2 other jobs and going to school full time. And it took me 8 years to get my bachelor's degree. And I thought something was wrong with me, right? I thought that it was, you know, I'm the first person in my family to go to college, like maybe this wasn't me. And over time, I started to understand that there is a greater system that is deficient, that was not designed to support me to, you know, get my education in a way that was efficient, that didn't require me to work another job and still have student loans to pay off one that I'm still paying off. So I think that that's a core message. And I think that establishing that shared understanding of the system with the workforce to better equip them to do something about it. And when they do, we have to uplift and prioritize the voices of educators to understand exactly what an equitable and comprehensive system means. I think this is a vision and a system that has to be driven by educators themselves. And so I think that from that, we have to really prioritize not only hearing from, it's impactful to be compelled by stories of educators, but that's not enough. I know just what she has shared, she doesn't share it to compel people to say, oh, like this is, no, we have to listen to them and act like you can hear them, but actually deeply listen and prioritize what this actually mean, how these inequities show up in their work, and what are their ideas for solutions to address them. And not only do we have to hear them and listen to them, we have to believe them. We have to believe them. So I think that that's a key component. And the second thing is we have to hold with us, well, one, the deficiency is in the system and not the workforce. And also 2, when children, you know, leave their homes and show up to the schoolhouse ready to learn, they enter that classroom, teachers are leaving their families, their homes, coming in, showing up to work, and it's the same exact space where children are learning and doing their learning. It's the same exact place as the teacher's work environment. So they're inextricably linked. And so we have to think about it that way. So if we are thinking about quality and metrics only in the lens of service to a child, we're actually perpetuating these inequities for the workforce. Educators aren't a vessel simply to reach children. That's not why they do this work, right? So they're equal participants in the system and need to be engaged and treated as such. So I think those are the 2 things I really wanted to lift up.
Thank you so much, Dr. Williams. And your center has done such incredible work with the tool, I think, of the sequel, which focuses on and looks at what is this workplace environment for the people who live and breathe, and this is their work. This is their workplace. And I really appreciate that. We just have a minute or 2 left. Are there some closing thoughts, 20-second soundbite from each of you as we close out that you would like to share? You've all been incredibly powerful speakers, and appreciative of it, and also mindful of the warning. We can't just hear this. We need to listen and do and believe in these words and let it impact our actions. Anyone?
I feel encouraged that I see in the comments and I hear from the panelists, my fellow panelists, about the number of years we have collectively on this call in early childhood and how long we've been talking about these issues. But thank goodness our elected leaders are starting to talk about these issues. We talked about it so long that some light bulbs are starting to come on and legislation is in motion and judges are, setting mandates and so on and so forth. So we're slowly moving the train, and there's a lot to be thankful for. There's still a lot of ways we could grow. I mean, I think we tie subsidy to quality. We could also tie subsidy to a wage.
Yes.
We are already saying that we have a minimum educational requirement for our teachers, and that should come with a wage requirement for their for providers, and that could be tied in the subsidy system. The way our teachers fill out their market rate surveys is very important. And we know that there's a lot of inequity by county in the state and what subsidy rates centers receive. And so helping our providers fill that out accurately. And then I think, we hear our local leaders, they could probably tell you, we beat the drum all the time. We're not just another, as a Smart Start, we're not just another nonprofit out here. We're actually we are administering state dollars for early education. Learning begins at birth. We are part of the education allocation. We are not a slice out of that pie. We make it a bigger pie. We're not taking from to give to another. We are growing the pie. And that, as our elected leaders are looking at early childhood, they need to look at it the same way they looked at K-12. And that's just we're gonna have to continue beating that drum and continue talking. It's just a shifted mindset, but we need to keep talking about it.
Yeah, I couldn't agree more. And to continue to develop and drive awareness in the K-12 system of the importance. I think it's there often, and yet we're not giving them a platform to say, yes, actually, we can't have children showing up here without high quality birth to 5 programs and services, education and care. And you do find principals and teachers in K-12 who say, oh yeah, well, of course. And how much are you making an hour in the field?
Yeah, exactly.
Thank you. I think we've hit our time. I feel badly not giving everyone a chance to say closing words, but I think you all did an incredible job of providing these important messages throughout your comments. So I'm very appreciative. I'm seeing the chat. There's more to follow up on. I'd love to get into the how do we pay and how do private providers pay at a $15 an hour. And so we'll continue the conversations in ways that we can. There is a Survey Monkey for feedback on the panel, and a link to the other session recordings that we're hopeful you'll access. And thank you all. I hope you have a wonderful rest of your Thursdays. Appreciate you joining us, and thank you for the great work you do day in and day out.